Hello and welcome everyone to our Croí Connects series, where we aim to get answers to all your burning cardiovascular health and lifestyle related questions. This month, we're going to talk about sleep. We know that sleep is essential for our health. We know that the quality of our sleep can impact our cardiovascular health. So it is really important that we are aware of the things that we can do to ensure that we get the best night's sleep that we can. Living through this pandemic for the last year has played havoc with our routines in general, but sleep in particular. We'll be chatting to our guest today about whether lockdown has exacerbated this problem, and could it be that the pandemic will leave in its wake many more people with sleep disorders who might never have had an issue with sleep in the past. So this month, we're delighted to be joined by Breege Leddy of the Insomnia Clinic. Breege is a sleep therapist and has qualified in medical physics and physiological measurement. And she has worked as a sleep physiologist in the sleep disorders lab at the Mater Private Hospital. Breege, you're very welcome virtually to Galway. Thank you for joining us today.
Yeah. Thank you for having me, Annie. It's lovely to be here.
No, we're delighted. And this is one of our hot topics at the moment is sleep. Everybody seems to be talking about sleep. So we've compiled a number of the most commonly asked questions that our health team get on a daily basis. And we're going to try and get through as many as we possibly can. So let's start with the basics. How many hours of sleep a night should we all get? Should I get the same as you? Should we be getting something different? Is there a rule of thumb? What's the situation?
Yeah, and I suppose that's probably the most common question I get asked as well. How much sleep should I be getting? And to be honest, I never give an exact answer, because it is the amount of sleep we need is as individual to us as the colour of our eyes or the colour of your hair. So just I need X number of hours doesn't mean that you need the same number of hours. There are guidelines and there are recommendations. And for adults, for young adults, it's anywhere between 6 to 10 hours. Everybody's different. You could need 6 hours, you could need 10 hours. I suppose the correct answer to your question is how much sleep should I be getting? It's the amount of sleep you get on a regular basis that's good quality, good consolidated sleep that allows you to wake up feeling relatively refreshed and to stop you falling asleep during your wakeful hours. That's the amount of sleep you actually need.
Okay, that's perfect. Thank you, Breege. So just on that then, if I prefer to stay up late and stay up really late and then get up really late the next day, and I'm getting good sleep, then that's okay.
Absolutely.
That's okay. Yeah.
Because that all goes back to this natural biological rhythm that we have. And yes, it's a genetic makeup. You have the night owls and you have the morning larks. And I suppose teenagers are a brilliant example of that. They have a thing what's called delayed sleep phase syndrome, where this whole biological rhythm or this body clock gets pushed forward. So it's perfectly natural for teenagers to maybe not feel sleepy till maybe 3 or 4 o'clock in the morning and then wake up at noon or 1 p.m. So yeah, they're falling within their normal rhythm.
So all of those people that are living in the house with nocturnal people at the moment, even in the middle of this lockdown, it's okay as long as for yourself, for your health, as long as you're getting a good night's sleep.
Absolutely.
Yeah.
We actually perform to the best of our ability when we are falling within our natural rhythm, which is fine for these days. But it probably doesn't work so well when it's a thing we have to get back up for work at 7 in the morning or go back into school.
Yeah.
Go back to school might find a little bit of a
more difficult.
Absolutely.
And that's the thing, I guess. So if you are in that rhythm of doing that, or that's the kind of person that you are, and then suddenly you get a job or you have to, for whatever reason, you have to start making yourself wake up at 9 o'clock in the morning or for a 9 o'clock start or a 7 o'clock start. And then, but you are a night owl as opposed to a morning lark. How does that, how can you make your body happy with that, I suppose?
Yeah, look, you might never be happy with it, but you can do it. You can bring yourself back gradually, because we're surrounded by the environment. We're surrounded by signals and triggers that help to give the body a sense of time. So while we might always be a natural night owl, if we were left to kind of what we call free run our rhythm, but by using these kind of external or environmental cues, we can bring ourselves back into a kind of a routine that if you are a night owl, you still have to get up at your 7 in the morning. So you can bring things back gently. You will have to do it. Sleep doesn't like big changes. So it's all about doing everything very, very gradually.
Very gradually. Very good. Very good. And then let's talk a little bit about sleep disruption. What causes it? And are people sleeping worse now than they did last year? Even though I do appreciate that there are people who have always had issues with sleep long before the pandemic ever came along.
Absolutely. I mean, there are so many reasons why our sleep can be disrupted. I mean, in terms of sleep disorders, there are over 80 sleep disorders. So it could be possible that it's one of those sleep disorders. I suppose the most common sleep disorder of the whole lot is insomnia, which we've seen a huge increase since the start of the pandemic. And I suppose a lot of us have now seen the word called, coronasomnia. And I
Yes.
suppose that's when you ask, some people say, is that an actual thing? Well, it kind of is and it isn't. I suppose coronasomnia has been more made up by the media than by the medics. It's really just the normal insomnia, and that has been caused by a huge stressor that has come into our lives, which is the pandemic, and has brought great change to our lives. And any kind of change, whether it be bad change or even good change, has the potential to interrupt or disturb our sleep.
Yeah, and I suppose you just mentioned a stressor there, and stress, I suppose, is one of those big things. And whether we're in the time of COVID or not, people will always have stress in their lives, and things on your mind.
Absolutely.
That affects your sleep. Is there anything that you can do in terms of
stress plays a huge
alleviating that?
In disturbing our sleep? And when we talk about stress or kind of anxiety or worry, we also have to talk about a thing called cortisol, which is the stress hormone. And we know that people with insomnia have higher levels of this stress hormone, cortisol, prior to going to bed. Whereas people that don't have stress don't have these higher levels of cortisol prior to bedtime. But these higher levels of cortisol actually lead to physical changes within the brain activity while we actually sleep. So it causes this physiological response, and that leads to a very, very disturbed or a very restless sleep. So yeah, stress has always been there, and I suppose that's one thing we can guarantee with life. It's always going to bring in stresses, but there are tools and techniques that you can do in order to make sure that this stress doesn't impact our sleep too much. And that's the key issue, to not allow that to impact our sleep. But certainly in times since COVID, there has been a huge increase in insomnia, because let's face it, there's very little good news at the minute.
No.
By stress and anxiety and worry, and also our whole routines have been absolutely, completely upheavaled, and that leads to this disturbance or a disruption of this whole natural rhythm. We're losing all sense of time. We don't have those social cues there that we had previously. I know in terms of the clinic here, we've seen an increase of over 40% in people presenting with insomnia.
Oh my goodness.
With insomnia, and that's in line with all of the international studies that are coming out now, because there's been huge amount of research now showing how the pandemic is actually affecting our sleep.
In terms of waking every day, if I started waking up at 4 o'clock every morning for no apparent reason, and I can't get back to sleep, two things, I suppose. What can I do, and does that make me an insomniac?
Well, it can, because there's a couple of features of they're very kind of, we basically diagnose insomnia on someone's clinical history, and there are different types of insomnia. There is a type where you have problems initially getting off to sleep, so you're lying there for ages and ages and just can't get off to sleep. You also can have insomnia where you've no problem getting off to sleep, but you can't stay asleep. We also have this early morning awakenings where you are waking up quite early, and you just can't get back to sleep, and you're not getting enough sleep then. But also as well, it can be a mixture. It can change. This is the whole problem with insomnia. You're getting into bed at night, but you have no idea what's ahead of you that night. So yeah. The getting up early, it can be an indication of insomnia, and sometimes those early morning awakenings can go with maybe a depression or something like that, some of the mental health disorders as well. So there's a little bit, the two of them can be quite directly linked as well.
Okay. So quite often there can be other things going on, yeah. And what can we do about that in normal circumstances?
I mean, look, we all go through periods where we don't sleep well, and we can have the odd sleepless night, and that's what we would call maybe a transient insomnia or a short-term insomnia, and that's normal. It's normal to have a bad night's sleep. We don't have to be brilliant at sleeping. We don't have to get 100% every night while we sleep. But usually, if this nighttime problem starts to have a daytime consequence, or it starts to impact your functioning the next day, if it's happening 3 nights out of 7, And if it's going on for 3 months or more, then you need a kind of a clinical intervention. I suppose in terms of insomnia, there are two treatment options. There are your short-term option, which is your sleeping medication, and that is really a short-term, as in a couple of weeks, or your long-term treatment when it goes 3 months or more, you're into the chronic stage. That's the thing called cognitive behavioral therapy for insomnia. But as I said, there are we all can have the odd bad night, and just not to say that it's normal to have a bad night's sleep. But I suppose this brings us into the whole idea of, or what we call sleep hygiene, and that's for kind of more short-term problem where you start to have a bit of an issue with sleep to try to get you out of that problem quickly.
Yeah, and so we hear that term a lot, sleep hygiene. Exactly what is it, or what can you do to make sure that you have good sleep hygiene?
I suppose I'm having a bit of a love-hate relationship with sleep hygiene now, because there's so much information out there now about sleep. There's never been more information.
Yes.
But a lot of the information we're seeing on social media and on newspapers and stuff, it's just the sleep hygiene. And these are basically good behaviours that we do during the day, in order to help us sleep. Because really your preparation for sleep starts the minute we wake up. So it will be things like, not drinking too much caffeine, having a wind down time before bed, not looking at your screen right before bed, things like that, exercise, incorporating exercise. All of those things really make up sleep hygiene. Also, we kind of bring in the bedroom environment as well to make sure there's optimum conditions. And that's great. If you're doing all of those things, it's the stuff we should all be doing anyway. But we don't want to be too kind of, regimental about it either, because when you're too regimental about it, you're nearly inflicting a sleep issue. You're trying too hard. But I suppose when I see, by the time people get to me, they've better sleep hygiene than I do, to be honest. But they still have a huge issue with their sleep. Sleep hygiene is not indicated for the treatment of any sleep disorder. And when you have somebody there and you're saying, right, I'm doing all of the right things, Breege, and nothing is working for me, so there must be something really wrong with my sleep. I can't be fixed. Well, no, because you're doing sleep hygiene, but that's not going to fix an insomnia disorder or any type of disorder. It's just the stuff we should all be doing.
What about drinking tea and coffee and those kind of things? That's the we all know that you shouldn't be doing that before you go to bed. So
absolutely. I mean, look, the rule of thumb is you're allowed to have maybe 2 to 3 caffeinated products a day, no later than by lunchtime. Because caffeine is a stimulant and it can stay in our body for a long time. It can take up to 9 hours to leave our system. So you don't want to be guzzling down mugs of coffee, between 7, 8, 9 o'clock at night. But also a lot of the time, people that are sleepy, they're using the caffeine as a bit of a crutch to try to get them through the day, because it does. You start to feel the effects of the caffeine in about 20 minutes. But you know what? If you have a cup of coffee every so often at maybe 6 o'clock in the evening, it's not going to be the cause of your insomnia, So, and I see people again that love their coffee, but they've completely eliminated it because they think, oh no, this is going to have an impact on my night's sleep. I'm like, do you know what? Life is miserable enough. If you enjoy your coffee, get back to your coffee, but just don't go guzzling down, 6 and 7 mugs of it a day.
Yeah, absolutely. Perfect. And that said, then, in terms of catching up on sleep, if you do find that you're sleepy during the day and that kind of thing, what about taking naps? What about the famous power nap? You're just talking about coffee there. What is it?
Yeah, look, we all talk about this power nap, and there is such a thing as a power nap. There are a couple of reasons why people nap. Usually we nap because we're not getting our proper sleep the night before. So the quality of sleep can be affected. We might not be getting enough of it. But also there's a cultural issue as well with naps. And it can also be a habit as well. Ideally, if you find that you're needing to nap during the day, you have to look at your prior night's sleep. Because if you're getting enough of that sleep and the proper quality of sleep, you shouldn't need to nap. But if, for example, you don't get enough sleep on one night, yes, you can have a power nap the next day. But the timing of it is crucial and the duration of it is crucial. The best nap you can have is about 20 minutes, the short nap, because with that shorter nap, you're more likely to not enter into a deep sleep. Because if you go longer than that, you probably will enter into that deep sleep. And if you wake up from a deep sleep, you'll be groggy, you'll be disorientated, and you'll feel worse than you did before the nap. So short, snappy nap. but also have it earlier on in the day. Because if you have a nap later on in the day or in the evening time, it's going to affect what we call this sleep pressure. Because while you're awake, we're constantly accumulating the sleep pressure. It's kind of like blowing up a balloon. That's the analogy I always give. So if you can imagine waking up first thing in the morning, you start blowing up this balloon. In order for you to kind of need sleep, that balloon has to be about to burst. There has to be full of sleep pressure. But if you have a nap, you're just sucking air out of that balloon.
Okay.
And so it's reducing your sleep pressure and reducing your sleep need.
Very interesting. I hadn't heard that before. So that brings me on then to misconceptions, common misconceptions that we have about sleep, all those things that we've just mentioned there. What are the other things that we all, they're kind of urban myths at this stage, we all believe we have to do this?
Yeah. Oh, there's lots of urban myths when it comes to sleep. I read new ones all the time. And I suppose the first misconception or misperception we have about sleep is that I need 8 hours sleep. You may not need 8 hours sleep. And I've seen this time and time again. And again, this is because what's out there, you know, we all have heard you must get 8 hours sleep. Because if you don't get 8 hours sleep, all these awful things are going to happen to you. But if you're getting less than 8 hours sleep, and I said you're highly functioning, it's fine. But if you now try to get these, so say for example, you get 6 hours sleep every night, you're waking up refreshed, highly functioning during the day, but you're constantly seeing you need 8 hours. Now there's a bit of worry starting to kind of kick in. Yeah. You know, maybe I should be getting these 8 hours because, okay, it might, you know, I might run into issues down the line. So now you're trying to get extra sleep. It's not going to happen because if you need 6 hours, that's the amount of sleep you need. So now you're trying to get this extra sleep. It's not happening. It's like kind of an area of performance anxiety now is kicking in.
Yes, exactly.
And now you start to have this anxiety around sleep. And once that happens, you actually start, it can lead you into a whole problem with insomnia. And I've seen that with people, you know, before. And sometimes it just takes saying to them, look, you're fine. You're highly functioning on your 6 hours sleep. That's what you need at this stage in your life. Because remember, your need for sleep can change as we progress through life.
Yeah, I was just going to ask you that. So as you get older, apparently you need more sleep, you need less sleep. Is that correct?
You need less sleep. Yeah, you do. When you think of babies and up to teenagers, I mean, they need growth hormone, all of this. So there's so much kind of repair and, you know, growing that happens while we sleep. So they need huge amounts of sleep. But as we start to kind of get older and older, the need for sleep just decreases. You know, we're not using up as much energy. You know, we don't need the kind of the repair that we would have once need. So yeah, as we grow through life, older people, and also I suppose it's the body kind of preparing you for old age because you're more likely to maybe have your sleep disrupted by pain or other kind of medical conditions that's there as well.
Yeah. So basically stay up until you're tired and then go to bed when you're tired. You don't need to be forcing yourself into this box of the
Absolutely. Yeah. Now, by tired is different to feeling sleepy. And that's that's where people can run into a problem as well. They can go to bed because, you know, they're exhausted, they've had a long day and they're tired, but that doesn't necessarily mean that they're sleepy. Sleepy means that sleep pressure is actually there. So recognizing this feeling sleepy can actually be quite difficult, and particularly for people that have a problem with insomnia, they don't know what it's like to feel sleepy. They've nearly lost the ability to feel sleepy.
So how do I know if I'm tired or sleepy?
Yeah, if it's a thing that you're genuinely sleepy, you're going to fall asleep quickly and you're more likely to stay asleep and you're more likely to get good quality sleep. As long as you don't have another kind of physical sleep disorder that's in there that's going to impact on your ability to get that sleep.
So another issue that comes up a lot with questions for our health team is with regard to snoring. And people who snore a lot at night, that has issues for a lot of people. It might have issues for everybody in the house. It might have issues for your partner. What's the situation with snoring?
Look, most of the time it's an issue for everyone except the person that's actually snoring because they're asleep. They don't know this is happening. So it's usually the bed partner that actually makes the complaint in the first instance. Snoring is basically it's to do with the airway. And the airway is just kind of relaxing in on itself, which it does as we sleep. Everything just relaxes in. So it's kind of a rattling around of the airway. Things like if, you know, for people that wouldn't normally snore, if they've had a bit of alcohol on board, The alcohol is a muscle relaxant,
Okay.
so everything just relaxes in and becomes a little bit floppy. So the noise is really the vibration of the airway. Now, we can be just a simple snorer, you know, and that's more of a kind of a nuisance than anything else. And we might just snore maybe when we lie on our back or whatever, or as I said, if we've alcohol on board. But snoring can be an indication of a more serious disorder, which is what we call obstructive sleep apnea syndrome.
Mm-hmm.
And that's where the airway is really collapsing in on itself. And basically the person is either stopping breathing for 10 seconds or longer, or they have a reduction in their breathing effort for 10 seconds or longer. So a way of distinguishing a simple snorer as to somebody that has sleep apnea, because not all snorers have sleep apnea.
I was going to ask that question.
Yeah, you can be just a simple snorer, but majority of people with obstructive sleep apnea will be pretty bad snorers. So there's a snore, then everything goes quiet, and then it comes back with another snore. So that's kind of more the pattern than just the kind of the repetitive snoring. Everything was very, very quiet because basically the patient has really stopped breathing. And what the kind of the more harmful kind of side effects of that is there's drops in their oxygen levels because the airway has kind of closed off, or there's a reduction in the airway. So oxygen levels dip down. That then in turn sends a signal to the brain to say, right, okay, this person's not breathing. So the brain's way of rectifying that is bringing them from a deeper stage of sleep to a very, very lighter stage of sleep. It's like someone constantly giving them a little bit of a nudge to try to wake them up. And I suppose in terms of cardiovascular issues, that puts tremendous pressure on the heart, because the heart has to give that extra push to get everything going again. So that if you have a significant degree of obstructive sleep apnea and it goes untreated, you can nearly guarantee that you're going to run into problems with high blood pressure, and then all the other cardiovascular problems that go along with that. So it's really important to get that diagnosed and to get a treatment. Some other kind of telltale signs to about obstructive sleep apnea is there are other symptoms like having to get up to go to the toilet during the night. There might be night sweats in there. It can be very fragmented sleep. There might be nightmares with the drops in the oxygen levels. But these people tend to wake up and they feel very unrefreshed, and they're extremely sleepy during the day. It doesn't matter how much sleep they get, they'll never feel refreshed because they're not getting the proper quality sleep.
Okay, so if somebody is looking at this now and is thinking that's me or that's my partner, their first port of call is their GP, and then they're referred for what?
Absolutely. And I said sometimes it can be the bed partner that knows more about this, because they're the one witnessing it. Go to the GP. You would need then to get a referral on to a sleep lab, where you'd go in for an overnight sleep study to look at basically your breathing, your oxygen levels, your heart rate, your brain activity, the different stages of sleep. And then depending on the results of that, and depending on the severity and the cause of the obstructive sleep apnea syndrome, usually the most common form of treatment is a thing called CPAP, which is continuous positive airway pressure. So that's the treatment of choice for that. But that will be discussed with the sleep consultant depending on the results. Yeah.
And that does just as totally following on from that, then one of our questions is with regard to a CPAP machine, and somebody saying that they really can't tolerate it in terms of trying to get a good night's sleep. What can they do?
I suppose, look, it's difficult to get used to this thing, because it's a completely new thing. This machine that's now pushing air pressure at you, and usually it does take a bit of time to get used to. Majority of the time, it's not really the treatment as such, it's usually the mask is the issue. And now there are so many masks out there. I suppose comfort, to make sure that it's actually not leaking, because if it's leaking, it can cause air to escape, so you're not getting your proper pressure, it would be noisy. So I think mask is the kind of the most important thing, is to get a really good fitting mask, and that's absolutely crucial in the treatment. And just try to adapt to it, make it as part, incorporate it into your part of your routine, because if you do have obstructive sleep apnea, it's absolutely crucial that you use that treatment anytime that you're asleep.
Yeah. And is there a pillow? Is there a particular pillow that you get if you have sleep apnea? Or is that something?
There is, and it can be. Now, it's not a treat. There is no cure for sleep apnea as such. It's more of a treatment, that the option that you use.
Okay.
Yes, there is a particular pillow. Now, if you're very mild sleep apnea and it's not really an issue, or maybe you're just a simple snorer, the pillow can be good because it kind of elevates you up a little bit and kind of opens up the airway. If it's a thing that you have really significant sleep apnea, a pillow is not really going to work.
Yeah.
It might help with your CPAP machine as well to make it a little bit more comfortable, because you can maneuver around a little bit more. But it's certainly not going to replace the CPAP as a treatment option.
As a treatment. Okay.
Yeah.
Okay, perfect. Okay. So a couple of other things. We're running out of time here very quickly, but very quickly I wanted to ask you about a sleep physiologist, what exactly it is. And you've probably given us a good idea there now, but just briefly, what exactly it is.
Yeah, I suppose if anybody has been diagnosed or is going into for the diagnosis of any sleep disorder, they're going to meet somebody like me. So the physiologist, I mean, for people that may have had heart issues as well, if they have heart like echoes or stress tests or anything like that, it's a physiologist that's doing it. So basically, we carry out all of these tests, these diagnostic tests. In terms of sleep, we would have been setting the patient up with electrodes on the head. We'd be, putting all the equipment on them, and basically we'd be coming in the next morning, and I would have been sitting down in front of a computer, and I would have been analysing those sleep studies and putting a whole report together. We'd be highly involved in the whole treatment of the different disorders, like, say, for example, CPAP treatment. We would be educating the people on the CPAPs. We would be going through everything with their CPAPs. It's basically, we'd be working quite in close contact with the consultant. So yeah, we're, as I said, there's sleep physiologists, there's cardiac physiologists, there are neurophysiologists. So if you go into a hospital for most of any kind of these diagnostic tests, you're probably meeting somebody similar to me.
Like you.
Yeah.
And that's good too, I suppose, to hear that there are things that you can do if you can't figure out your sleeping issues in the normal course of events. You can work with somebody like you and with your consultant, and you can see results.
Absolutely. I mean, there's over 80 sleep disorders. I mean, that's the thing. So it's absolutely crucial. If there's something wrong with your sleep and you're not happy with your sleep, it's absolutely crucial to get a proper diagnosis. In the terms of insomnia, your GP will do your diagnosis. For any of the other sleep disorders, you're probably going to have to go in to have an overnight sleep study done to see what's going on. Because a lot of these sleep disorders, their symptoms can be pretty similar. So you just know you're not getting good sleep, but we have to find out why you're not getting good sleep. And the only way you can do that is by looking at your sleep and monitoring it. So it's absolutely crucial to get a proper diagnosis. But for all sleep disorders, there are treatment options, and that's the thing to remember. Now, in terms of insomnia, yeah, the CBTI has a success rate of over 80%. But it can be tough going, any kind of treatment, it takes a bit of time to kind of kick in, as well. But yeah, there are certainly really good treatment for any sleep disorder. But I suppose in terms of sleep medicine, it's a relatively new area of medicine.
Yes.
It's only really in the 1980s that we started to look at sleep. So
yeah.
It's constantly evolving, and there's always new stuff coming on board.
Absolutely. Great, Breege. Thank you so much. That's been a very interesting conversation. Can I just ask you before we finish up to give me maybe your 3 or 4 top tips about what we can all do, what's within our control to do in our daily lives to improve the quality of our sleep?
Yeah, I suppose one of the most important things is to set an alarm clock every single morning and get up at the same time every single morning, 7 days a week. That is absolutely crucial at stabilizing this whole body clock or this circadian rhythm. We tend to focus more on bedtime, but the bedtime doesn't have to be as strict as the get up time. Go to bed when you feel sleepy, but you get up at that same time, no matter how much or how little sleep you get. It's so important to get up at that same time every morning. The next thing, I suppose, is routine throughout the day. Have your meal times at the same time every day. That's really important at trying to remember it's a 24-hour cycle. We have to have structure during our day, because if we don't have structure during the day, we're not going to have structure during the night. Exercise is so important, not just for our physical health, but also for our mental health. But it's hugely important. It plays a huge role in our sleep-wake cycle. So if you could get outside exercise, because you're getting exposure to bright light early in the morning, and if you get that exercise early in the morning, there's more and more studies showing that that's the best time in terms of your sleep to have that exercise. I suppose in the latter end of the night, we have to have some kind of a wind down time. You know, don't be kind of working right up to bedtime or studying right up to bedtime. We have to have a protected time of at least an hour to 2 hours where we literally just switch off everything and we just relax and wind down and wait until we're feeling sleepy, and be as relaxed as possible and not to worry about sleep and not to panic about sleep. Sleep is the most natural biological thing that we have. It's as natural as breathing. It will kick in, and usually it's just when we try to kind of, when that rhythm falls out of sync, we try to kind of get it back into a normal pattern. But if you don't have the right tools, you're kind of nearly onto onto a loss straight away. So it's about routine, and get up at the same time every day, and having a wind down time before bed.
And sorry, if your computer is in the same room, just in the current situation, if your computer is in the same room as your bed, if your work is in the same room as your bedroom, but people don't have options, I suppose just break. What would you suggest there? Break the cycle, I suppose.
Yeah, the best thing you can do, and I because so many people are doing this, we don't have the luxury of having that extra room, you know, to make into our office. Wherever you have your office desk, have it that you're not facing your bed. Be looking out a window, be even looking into a wall, you know, or get a kind of a boost of bright light when you're in there working. Have your bed behind you so that you could be basically in any room. You don't necessarily see it as your bedroom. And you have a dedicated start time and stop time for your work. You try to replicate your office hours as best you can. You have your breaks. You get out of that bedroom for your break. So you get up, and even things like getting dressed, you know, that's hugely important. You try to recreate your normal working day as best you can. I certainly wouldn't be sitting on the bed on the laptop come 9 o'clock, 10 o'clock, trying to finish off the bits of work that you just pushed off during the day. So it does take dedication and motivation, but you have to be very strict with it. Yeah.
Very good. Brilliant. Well, listen, Breege, thank you so much. That has been hugely informative, and we look forward to chatting to you again in the future. Croí Connects returns next month. Stay tuned to our website for updates and lots of great resources. Make sure to follow us on social media for all the latest. Thank you for watching. Bye.